Drive and Trafalgar, and we're seeing minor delays on
Comes down. This is where
facing post-pandemic, and we'll talk about that. But to begin with, lots of reactions still of the announcement yesterday from the provincial government, the health minister specifically, about changes and innovations, as they called them, in the healthcare plan here in Ontario. And in an effort, of course, to deal with these pressures in the healthcare system, the province is going to be changing things up a little bit with how things are done. And Tina Trajani from Global News has some details.
Shoring up Ontario's healthcare workforce using innovative models of care and making sure hospital beds are there for patients when they need them. All part of the plan announced today by the Health Minister, Sylvia Jones, who says this will address urgent pressures on the system while preparing for a possible winter surge.
We can no longer accept the status quo.
The plan to stabilize the healthcare system includes increasing surgeries performed at private clinics, with the province covering the cost.
Ontarians will always access healthcare with their OHIP card.
Also announced today, bringing in another 6,000 healthcare workers and temporarily covering the exam and registration fees for internationally trained nurses so they can get out on the floor faster.
We will continue to engage with our frontline partners, experts in their field, to imagine and implement a future that improves the care we provide to the people of Ontario. That's our promise to you.
Tina Trajani, Global News.
So you look at these things on the surface and the announcements as stated, and you think, well, maybe there's some substance to these things. Interestingly enough, though, a lot of the pushback from the medical profession especially has been very lukewarm to negative on this. I want to bring John Best into the conversation. John, of course, is the publisher of the Bay Observer. And, John, pleasure to have you back in the program.
Well, it's good to be with you, Bill.
Were you surprised by the feedback on this? I mean, the province said they were going to do something drastic, and they certainly seem to have checked that box with some of the things that they're proposing to do here.
Well, what surprises me, frankly, is the fact that a lot of these measures appear to be endorsed by the Ontario Medical Association. You'll notice I said the Ontario Medical Association, not the Ontario Hospital Association.
Yeah.
But it appears that the changes that they're making have had some consultation with at least one part of the medical community. I'm not surprised at any pushback, that any change in our healthcare system. There's so many vested interests involved in the healthcare system that you just can't imagine it ever getting a wholehearted endorsement. The question that sort of went into my mind is this has got to be kind of a long-term deal, Bill, because where are all these private clinics just waiting for more patients? We know about the Shoulders Clinic for hernias. It's been around for decades. But the idea that there's, that these clinics that are now going to take on things like cataract surgery and minor surgical procedures, to my mind, I don't know where they are. So to get them set up, I mean, it's obviously not something that's going to happen in the next 12 months.
Well, and with that in mind, it begs the question about how long is this going to go on for? I mean, as the minister mentioned yesterday, and I'm just trying to extrapolate, where this is going to go from what she said yesterday. If you need surgery and they say, okay, you're going to be scheduled at this private clinic, just use your OHIP card. In other words, the government is going to subsidize those private sector healthcare centers. How long are they going to be able to do that before they just say, look, this is not sustainable? I mean, if it's either going to be a public health system or not. And I'm not being naive about this. I think you and I have talked about this in the past. I mean, the estimates are about 35% of the healthcare delivery in this province is already, done in private sector, and there's in some machinations of it anyway. So, for those that say, well, they're going to privatize everything, that horse is already out of the barn. But are they going to go all the way towards that? And how's this going to look? And more importantly, as you say, how's it going to operate? How efficient is this going to be?
Well, the whole purpose of these changes is to increase efficiency. First of all, the hospital system is always going to be totally publicly funded. There's absolutely no way that you could transition our hospital system into any kind of private system, and I've never heard anybody suggest that. So we're really, I think, nibbling around the fringes in some ways, Bill. Trying to alleviate pressures here and there. I just can't see any of this. Probably the quickest improvement that she referred to is getting these foreign-trained nurses getting their accreditation speeded up, and they're talking about removing the the exam fees and the license fees. I don't know if that was the barrier to them getting into the system. I suspect that was not the number one issue. So there's a lot, we constantly use the phrase the devil's in the details, but in this case, it really is the case. There's so much there. I think though what she's trying to do, what Ford and the minister are trying to do, is get rid of this ideological notion that any kind of privatize, and when we talk about privatization, we're only talking about who the deliverer of the service is, because it will, according to what they're telling us, still be paid by OHIP. So a point was made in one of the Toronto papers this morning by one of the columnists that really, if you think about it, your family doctor is essentially a private entrepreneur. He's rented office space, he's bought equipment, he's hired help, and he sends the bill to OHIP. So, what's the difference between that, somebody, maybe giving you a needle and somebody that maybe is doing a cataract removal and also billing OHIP. So there's a lot of, ideological language in the opposition that I think I'm not suggesting it needs to be dismissed, but it certainly needs to be taken apart and looked at closely.
Well, and she referred to that bit by saying there are some people that just will argue for the status quo.
Status quo clearly with more money. Yeah, status quo, but just keep shoveling more money at it. So, I think intuitively we would say that's probably not going to work, and that maybe smaller boutique delivery makes sense in some cases. I'm not an expert on this, but I'm willing to listen anyway.
Well, and there are some positive signs. The fact that they're going to give more, responsibility to paramedics, I think, is a good move too. I mean, that's going to alleviate a lot of the pressure, I think, in ERs and some of that layover time where they're waiting there for sometimes hours at a time until they can hand this off to some of the understaffed ERs that are already there. The elephant in the room, though, that was brought up a couple of times in the Q&A after her announcement yesterday, was compensation for nurses, which has been a key element and a key part of their concern for quite some time right now. And once again, of course, they're not going to remove the bill that limits their increases to 1%, but it does expire in the springtime. We don't know what's going to happen then, though. But that seems to be, in large part, John, one of the reasons why so many nurses are leaving the profession, is the compensation and obviously the burnout that we've talked about in the last little while. And I'm not so sure that she did anything to address those yesterday.
No, and but I think it partially answers the question of where are you going to find the money for some of this. If they can improve the number of nurses in the system, then they can probably decrease their reliance on these agencies. And we know, the government's paying those agency nurses right now, and they're paying them a lot more than they're paying the regular nurses. So if you can reduce that agency dependency, maybe that creates more money. I mean, I can't see this system not involving another big increase in healthcare spending. And I think what they're trying to do is they're saying, okay, we know we're going to have to spend more money. They're trying to get some more from the feds. But at the same time, we've got to find if we can make the system more efficient rather than simply upping the bill that we pay every month. I think that's what they're trying to do. Now, whether they're successful, we probably won't know for a couple of years.
And they were vague on a whole lot of points yesterday, too. And I guess to a point that's to be expected. I like any other government announcement, John, I guess this is going to roll out in stages, and they'll do the dog and pony show for each one of those announcements at each stage, and maybe we'll get some more details then. But it's certainly an ongoing problem. I mean, I was talking to Colin DeMello, the Global News, of course, Queen's Park chief yesterday, and he told me one story for one of the nursing associations where one nurse begged off work one day. So the hospital called with these agencies, and the agency sent the same nurse.
Yeah.
To cover the and of course the pay was double what they would have made ordinarily. I mean, those sort of inequities have to be addressed.
Well, and I think that kind of, sort of ridiculous situation tells you, if anybody tries to tell you the system is absolutely, it's maxed out, no question about that, but is it maxed out in terms of efficiency? There's a prime example where there's a lot going on. And then we look at the situation in Hamilton here, where patient records were improperly disclosed to people that shouldn't have seen them. Again, why did that, so you read the news release and they're talking about faxes. I mean, a system that is still so reliant on a piece of 1980s, 1990s technology, you got to ask yourself, is our healthcare system as efficient as we claim it to be? It's doing a great job. I mean, doesn't matter even with the COVID that if you needed quadruple heart surgery or you needed emergency cancer surgery, you still got it. It wasn't as good as it was before, and there's a lot of testing that's backlogged that could be people with very serious ailments that haven't been caught in time. But when just the idea that you've got an entire, the most expensive aspect of our government is operating and using technology like faxes, it cries for some kind of overhaul.
Well, and I know we've probably said this 1,000 times over the last 2.5 years, but the pandemic didn't necessarily create these problems, but it certainly exacerbated them and shone the light on them. And speaking of, John, I guess that's the other element to this that they didn't really address, but some doctors have talked about, is just about everyone who knows anything about what's going on with viruses says there's probably going to be another wave come September, October. I don't know how serious it's going to be, and hopefully it won't be serious, but you have to wonder, but if these changes are going to have any impact at all, if there's going to be another surge with hospitalizations. I mean, it was terrible what happened last time, having to cancel surgeries and things of that nature. And I guess the clock is ticking right now as to whether or not they can implement some of these things in time for something like that. I think the short answer is probably not.
No, I don't think. I think you're right, Bill. I know the local public health here issued a forecast, one of those Scarson forecasts, and clearly they're looking at a fairly significant uptick in hospital admissions towards December. Right now we're sitting around 1 or 1.5 COVID admissions a day, and it looks like it'll get up around 6 or more. And of course, once they get in there, they don't get out immediately. We're definitely going to go into another wave of COVID, although it seems to be morphing into something more like flu season now in terms of the severity. Thank God we have both vaccine and against it, and we also have actual medicines you can take to make it go away. So we're in, so much better shape than we were in 2020. But yeah, it's coming again, and as soon as the weather starts to cool down, we'll see it.
Well, yeah, and of course you mentioned flu itself. The last couple of years, of course, because we've been cloistered and vaccinated, I guess, for the most part anyway. Flu's been almost a non-issue for us, but who knows what's going to happen this winter too. So it's the pressures on the system, I think, that they're worried about. And there are a couple of other quick things here, encouraging doctors and nurses to go to underserved areas. I've been trying to do that for about 25 years with limited success. So good luck with that. I mean, it's something that needs to be done, but it's going to be fascinating to see just how this is going to roll out from community to community. Anyway, we shall see in the passage of time. By the way, we are going to talk about the impact it's going to have on long-term care. We'll do that a little bit later on in the show. As always, John, thank you so much for the input today. Great to have you with us again.
My pleasure, Bill.
Take care. That's John Best, publisher of the Bay Observer, with observations about the provincial government's new health plan and multifaceted health plan too. And we'll be dissecting that, I'm sure, for days, if not weeks ahead to find out exactly how it's going to impact our communities.